Hi, my name is Toni Young. I'm the founder and executive director of Community Education Group. And I'd like to welcome you to the second installment of Black and Red. That's Community Education Group's docuseries and podcasts where we talk to individuals in red states across the United States and in southern jurisdictions about COVID and other public health concerns. Take a moment to join us, and thank you again. So, here we are in our next installment of Black and Red. And, I'm excited about this talk for a whole bunch of reasons. One, because I haven't seen you since Hector was a puppy and he's a big dog now, right? And the other reason is because, man, you're a pharmacist, right? That's always amazing to me. And now you're teaching pharmacy.
It has always amazed you. Like you never believed it.
I know, right? I was like, you're a pharmacist. And I don't know what it is. Is that I guess, I have friends that are doctors, lawyers. I got lobbyists. I got, all kinds. But I don't think I know another pharmacist.
I've actually been a pharmacist for more than 20 years.
Get out of here. Wow. So you went, if I remember your resume correctly, who are you? Why don't we tell the people that first?
I am Dr. Tamara McCants. Toni knew me when I was foreman, but that's a whole nother story. I actually went to Florida A&M University for my PharmD, and I graduated in 2001.
Get out of here.
I really have been a practicing pharmacist for 20 years.
Wow. Now, have you always practiced pharmacy in a big box store, in a retail pharmacy?
Yep.
So tell people what the different types of pharmacy, because you could be a different type of pharmacist was what I know.
Well, my parents are Jamaican, so, I had several jobs throughout my career. So, but primarily in the community pharmacy setting, but mostly for independent pharmacies. So independently owned, what people call a small mom and pop. I worked for CVS as well in one of the toughest neighborhoods in DC. I've also worked for a managed care organization, so Kaiser, so that's a whole different realm of pharmacy. And of course, like you mentioned, I teach at Howard, so I'm a professor too. But pharmacists work in the government, they work for pharmaceutical companies, hospitals. A lot of people know, pharmacists that work in a hospital. It's various places that we could work.
Wow. And one of the things I think that brings me to you, particularly around the topic that we're going to talk about today, which is going to be COVID, influenza, HIV, and some other issues, right? Is that, West Virginia, when COVID began, Dr. Clay Marsh made a decision for the state of West Virginia to, rather than use big box pharmacies, to use those mom and pop pharmacies. And West Virginia was very, very successful at the beginning of COVID. They've hit a bit of a wall now. But, I think of it in terms of how is it that you see those small mom and pop playing a role, not just in COVID, though, but also in influenza vaccination, which I like to say that I think that one of the things that may have been happening over the last few years is that I feel like the flu was in the gym, right? The flu was in the gym on one treadmill, the cold was on the other treadmill, just watching what COVID was doing, going, oh, we can do that better when we get out, right? So because that's one of the things we want to do with this project is to help more people get vaccinated for COVID, but help people get vaccinated for the flu. And I think that those small pharmacies may play a big role. What do you think? So
when COVID vaccines first came out, the issue was compliance, because you could get people to get the first shot, but are they going to come back and get the second shot? And the difference between independent pharmacies and your large big box pharmacies, to be honest with you, is independent pharmacies, you have independently owned business owners. You're just going to care a little bit more when you own it, and you're going to work the extra mile as opposed to if you're just working for a big box and you're getting a check. But not all pharmacies are like that, but you just have a higher likelihood that you're going to pay a little bit more attention to the patient. And so that's probably why that decision was made, because they can know that somebody's going to follow up and call those people in 3 to 4 weeks to get that second shot. That's probably what it was. And you just have a little bit more of a pulse on your community. You know where they're working. You know what their schedules are. You know what their fears are. You know why they want to come in and why they don't want to come in. You know how many conversations you got to have with them before you could convince them. So you have to have conversations with people, because you can't expect people to just take directives from talking heads on a TV. Right. You need that one-on-one personal touch that the pharmacist always can give.
Well, where do you think that we are right now with engaging those kind of small mom and pop, small front, what I call those like kind of our retail pharmacies that, they're just right there on Main Street?
So everything is political. So if we don't want to address that or feel that, we got to know that everything is political. COVID vaccinations and vaccinations period is big business for pharmacies, because the reimbursement rates for just filling regular prescriptions, pharmacies can hardly keep the lights on. That's for your small pharmacies and for your large pharmacies. So while the independent pharmacies were first targeted to roll out COVID vaccines, everybody wanted a piece. But now, when you compare the independent pharmacy that may not have like that electronic system where, on the convenience of it, you have the CVS's, Walgreens, and now, and they're good too, because you still have people accessing vaccines better than they would if they were going to their doctor.
So here's the thing. What's the role of pharmacists in our response to COVID?
Pharmacist has always been the most accessible healthcare professional. A lot of people don't know that pharmacists, they go through a minimum of 6 years of school. The average pharmacists have 8 years of school.
Really?
4 years for their undergrad and then 4 years for their professional degree. And they're the only health expert that knows medication. We're the medication expert. Know it better than your nurse, your doctor, the specialist, everybody. We are the medication expert. So anything having to do with medications, we're going to know about it. But our gift is also to be able to explain it to the average person in language that they can understand. And that's the main role of the pharmacist, is to continue the conversation, to start the conversation, answer people's questions, make them feel at ease about taking the vaccine. Somebody that you can go to right at the corner, reach them pretty much. Some pharmacies are open 24 hours, whenever you want to, and talk to them, somebody educated about the vaccine.
So now, what about flu vaccines? So do the big box stores and retail pharmacies offer the flu vaccine or influenza vaccine as frequently now as they're doing with COVID, or more? Because you used to, right?
Yes. So vaccinations, as pharmacists, the ability for populations to be vaccinated increased when pharmacists got the ability to vaccinate. So we're probably celebrating on average about 25 years of pharmacists giving immunizations. And if you look at the growth of people that are immunized, that increased with pharmacists being able to immunize people. So pharmacists has always been offering vaccines. And now, especially during flu season, we have been offering vaccines even more so with COVID. And it's like we're offering more vaccines now. And because people are talking about vaccines, we're offering all kinds of vaccines, and people are asking about all kinds of vaccines, including the flu, COVID, pneumonia, herpes, Tdap, all of the vaccines now.
Shingles too, right?
Yep.
Okay.
Yep. So it's like the conversation about COVID is just making people be a little bit more aware about how they could prevent these diseases that a vaccine can help to ensure that you don't get it, pretty much.
Yeah. So, I mean, I think that's it, right? That's the big question. The big question is, many people say that we are now dealing with the folks that are vaccine hesitant. Most of the people I see, frankly, are vaccine no. So if the pharmacist plays such a big role, is there something that we can do, say, or give to pharmacists to help them kind of get back in the game? And I think I'm making the assumption that maybe, they've been benched for particularly big box stores, like no.
So this is what it is. When people are hesitant, overall, we have to understand why they are hesitant. And it really sometimes has nothing to do with what they think about the vaccine. A lot of people that are hesitant because this may be the only place in their life where they feel like they can actually make the decision. So oppressed people, or people that don't really have a lot of options, disadvantaged people, people that lack resources, when they have an opportunity to say, no, I'm not doing that, they're going to say that. I have people that come into the pharmacy. I ask everybody when they come in, you got your COVID shot? Do you want to get your COVID shot? They'll say no. What about the flu? Yeah, I'll take the flu. Whereas I bet you if I would have said, hey, you want your flu shot? They'd have said no. But it's just the fact that they felt like they could make the decision. Right. And I think that is what the biggest impact is. So with the pharmacist, again, if they're asking every single time the person come, all right, I know last time you said you didn't want it, but what about this time? All right, well, let me give you some information and we're going to talk about it next time. It's the continuance of the conversation.
So you think what we should be doing is not giving up on those folks that have not been vaccinated?
Definitely not. And not only do we not give up on them, but stop the stigma of blaming unvaccinated people for COVID. Mm-hmm. It's not fair, and it's really not even accurate. So for people that don't want to take the vaccine even today, we need to understand why. Mm-hmm. Why don't you? And the story is different for every single individual person, and stop lumping people in these groups that don't even make any sense and thinking that, oh, well, because they're Southern Baptist, this is why they're not getting the vaccine. And because this person is a white evangelist, this is why they're not getting the vaccine. No, it's a very individualized conversation.
And so that one-on-one with the pharmacist could really make all the difference in the world.
It is making a difference.
Okay.
It is the reason why the people that were hesitant are now getting it. Mm-hmm. I've seen it in my own practice, because again, every single time I see them, I'm asking them the question. Right. And so every single time, I already know when I'm wearing them down, because at first, you're not even going to take the information. But next time you come, all right, well, let me see the paper. Let me give you the paper. Right. You can talk about it, read about it on your own. And it also helps that more and more people are being vaccinated. And I also think that we're being more and more honest about the material that's going out there with the vaccine. Because at first it was like, take the vaccine, it's the cure-all. But now we're kind of being a little bit more targeted, like, okay, it's not going to stop you from getting COVID, but it is going to prevent you from going into the hospital. And we're just being a little bit more specific and giving people more information.
Right. So I have a couple of questions for you.
Mm-hmm.
Have you had COVID?
I have definitely had COVID.
You have? And what was it like for you?
I had COVID last January.
Uh-huh.
So I didn't have this new COVID,
Right.
and anything about viruses,
Yeah.
how they mutate, you
Right.
know how it affect different people. So for me, when I had COVID, I was really tired and I lost my sense of taste and smell, but that was it.
Right.
Like I didn't have, the anxiety
Mm-hmm.
of feeling like I was going to die, because that's what everybody was saying, was way worse than the symptoms I had ever experienced. Even it was way worse than the battle that I had with the flu the prior year,
Right.
So I had mild symptoms, thank God.
Right.
My sons they had a fever for 30 minutes, took a nap, and it was business as usual.
Right.
So, right. My symptoms were mild.
Right. So now let me ask you this about the flu vaccine and the COVID vaccine.
Mm-hmm.
So have you been vaccinated for the flu yet this year?
Yes, I have. And I have to be honest, I was never a flu vaccine person. Because, I already mentioned my parents Jamaican, I'm herbs, whatever. Like, I don't need any vaccines. But one thing I do, I teach pharmacists and pharmacy students how to administer vaccines. I'm a vaccine trainer. So it's such an oxymoron, but I can be honest with you about it. It's just whether or not you embrace Western medicine. Mm-hmm. But some things you just have to know. Nobody can afford to be sick. And I think what COVID highlighted was that why be sick when you don't have to be sick? You know what I mean? And so now I'm going to be an avid flu vac. I'm going to get the flu vaccine every year because I can't afford to be sick. I don't want to be sick. I don't want to be down bad for 5 to 6 days. Right. I'll just take this flu vaccine and it's going to work, you know?
I mean, and I think I'm the same way, right? I was definitely not a consistent flu getter. Mm-hmm. But I think after I hit, certainly after I hit 50, that pneumonia vaccine was looking real nice.
Yep.
And, and then I think I got the shingles vaccine because I was like, I saw an ad and I was like, oh, I don't think I want that. And then I think the same thing was for me with COVID. I was in a clinical trial. So I got vaccinated very early. I was an early adopter. And I think that that's one of the things that we have to figure out now is how is it that you get people to do what I call the harm reduction approach, which is maybe you're not going to get vaccinated this moment for COVID, but I want to keep talking to you. Can I get you vaccinated for influenza?
Yeah.
If I can't do that, can I talk to you about an HIV test?
Mm-hmm.
If I can't do that, can I talk to you about a hepatitis C test? If I can't do that, can I talk to you about, do you need a food basket?
Mm-hmm.
Then the next thing, can I talk to you about PrEP? I think that there are ways in which we have to just keep talking to people and let them know kind of what's available to them.
And see what you're doing and what you're highlighting that a lot of people don't understand is you're talking to people about taking care of their health overall. See, COVID or managing COVID or preventing yourself from COVID and the flu is ways that people take care of their health. But when you think about why are individuals not focusing on their health, it didn't just start with the pandemic. It's for a myriad of reasons because they don't have time or they don't even think about it. Or they're a single mother and they're just thinking about picking up their kids and working and going back. Or they work a job where the doctor is not open, so I can't never make it to the doctor on time. These are the things. So the conversations have to be had, and I wholeheartedly agree with you, not just about COVID, about everything having to manage your health and prevent you from being sick.
Right.
So,
we're sitting in D.C. right now, and the name of this project is Black and Red, and many people don't know that D.C. is considered Southern. And I think that one of the other things that, I think so frequently people still refer to D.C. as Chocolate City, but the demographics of D.C. have changed dramatically. Mm-hmm. And so it's expected that at the end of, I think, this year or early next, that D.C. will not be a majority African-American city anymore. Have you seen those changes? Have those changes had an impact? And I think about this a lot in part because I think about the role that globalization played on COVID. It's like that we don't, we talk about a certain country or that country, but we don't just talk about the fact that we don't live in an isolationist economy. We don't, I don't know, I don't think I have any friend that hasn't traveled outside of the country in the, last 3 years so travel happens, everything happens so differently now. We live in a global society. You can go online and order something from anywhere in the world and be in your house in 4 days. So the change that's happening in DC, how have you seen that affect your practice or vaccination or any of this?
That is a great question, and I can give you several examples. So first of all, the first vaccination clinic that I worked at was one that was hosted at Howard University Hospital on Georgia Avenue. I was shocked by the amount.
I want to stop. I'm sorry to interrupt you, but I want to stop you. Howard University is a historically Black college, which most people may probably know because the vice president attended it. But also, I think most people may just not know the line of HBCUs, and Howard's one of the most famous HBCUs.
It is the Mecca.
Right.
And so I was shocked at the amount of non-Black people that was coming to get the COVID vaccine.
At a historically Black college.
At the historically Black college at Howard University Hospital on Georgia Avenue. It's still kind of, the neighborhood's transitioning, but, and actually that neighborhood had Shaw, Petworth. The neighborhood is definitely transitioning, but I was still shocked at the mixture of races that came. And what I saw was that I was actually, if I'm 100% honest, I was a little annoyed because I knew that the reason why, because it was a lot of young white females who was not at the top of the tier in terms of who was getting the vaccine or who was eligible to get the vaccine coming in and getting the vaccine, because the way that you registered to get the vaccine was using the internet. So it highlighted a lot of disparities, so even though we were supposed to be targeting the elderly and people that had immunocompromised and, people that had comorbidities, those weren't the people that were coming in.
Right.
It was the people that knew how to access the internet and access the appointments before everybody else.
So the digital divide,
yes,
played a role. And so we see this, people don't, you think of DC, you think of this urban Mecca, right? But I always talk about this, particularly in our work in West Virginia, our work in Appalachia, is that, folks cannot access broadband. Even in my home in West Virginia, in order for me to use my cell phone, I have to have a micro cell phone
Mhm.
tower in my house. I don't, the way I access the internet is very different than the way I access the internet here in
Mhm.
DC. So were you able, so what happened?
Yep.
And because I don't know that we're far away from that now, right? How do we get folks access? There's vaccine out there, there's a booster out there, but how do I get, Miss Ann, Miss Emma, who is, on my block down the street, the information that she needs, because she's not on her phone all day.
Yeah.
She's not scrolling through Instagram.
And so before I answer that, I want to say one more thing. It also highlighted, because the population has changed here, who else wasn't getting a vaccine. And you know who else wasn't getting a vaccine? Ages 25 to like 35, making $75,000, $85,000 a year, or what we call, the millennials, or I don't even know if those are millennials now, because they just didn't want to. They didn't want to make the choice to do it, or they didn't have the time. So yeah, I felt like they had it all pegged wrong about who wasn't getting a vaccine. Because I know even with my own outreach, I wasn't targeting seniors. The seniors were coming up to us.
Right.
We had 95, 100, 102-year-olds coming in to get the vaccine. Those weren't the people we need to target. We need to target the younger people. Are
you saying younger, but are you saying younger Black people?
I was about to say it was, so younger people overall. So I'm talking about ages like 25 to 35, and definitely young Black males. Like people my nephew's age, I still don't think my nephew has the vaccine. Because he just don't believe in it, and he don't want to do it,
And so what's the conversation that we have with young Black men in Southern jurisdictions? Mm-hmm. Because I'm seeing it, in Maryland, also, in Florida, I know a couple of people down there, same thing. And I know two guys who were like, if I wasn't in the Army, I wouldn't have done it.
Mm-hmm. You've got, first of all, it's that overall health conversation. You can't expect them to just all of a sudden care about their health because it's COVID. Mm. It's an overall conversation about them taking time to take care of themselves and their health. Especially a young Black man, they on top of the world. They feel like they're invincible, And then I had the ones that tell me, well, I could walk out my building now and get shot tomorrow. So, what I got to live for? And it's people that really feel like that. Like, why am I trying to extend my life by getting a COVID vaccine when I could get shot tomorrow?
But I guess then that becomes the issue. What do we need to do to make sure that we're having conversations with men? And I do think that some of this is around men. I think particularly Black men. I think Latinx. But and younger white men too, about this health construct. I think again here, I think in DC we do see a lot of fentanyl deaths here in DC. Mm-hmm. But one of the things I'm doing in West Virginia, we're doing throughout Appalachia and a lot of the South, is that I liken it to a train, and I say that the engine on that train is substance use. It used to be injection substance use, but we're fighting a different fight these days, and that's the engine. You got hepatitis C and B in West Virginia that have been number 1 and number 2 for over a decade, which most people don't know. And then you've got low educational attainment, few job opportunities and choices, other behavioral health challenges. I think we don't talk about whether it's folks that are in mines in West Virginia that have lost jobs and don't know where the next job is coming from. That's post-traumatic stress disorder. Folks don't get it. They don't understand it. I don't think they understand how young Black men in DC are probably experiencing post-traumatic stress disorder, the number of deaths that they see, the number of deaths that they fear for themselves, their families, and their friends. And on the caboose of this train in West Virginia, I think we see HIV infection. And here, I think we see some higher numbers of HIV infection as well. The question is, what do we do to put in place to stop that train from running over the next generation?
We have to understand, you can't talk to people about health if their basic needs aren't met. I learned that real early in my HIV work. I can't talk to somebody about taking medications if they don't know where they're going to sleep tonight or if they don't know what they're going to eat that night. Once people's basic needs are met, then we could start talking to them about their health. Or we may try to have simultaneous conversations, but don't think you're about to talk to somebody about their health and their basic needs aren't being met.
How do we figure out whose basic needs are met, right?
We got to talk to them.
But that's what I'm saying. I mean, so how do we do that? Like when we look at programs that are kind of, out in rural communities or in southern communities, there's usually a great deal of distance. We already talked about how the fact that many of them don't have access to the internet, can't access the internet. How do you put your hands on them? How do you get a message to that person?
We have to meet the people where they are. And it all sounds so cliche, right? But the person that don't know where their next meal is coming from, they're not the homeless man on the street. Actually, the homeless man on the street got all the services. I'm talking about the person that works in the grocery stores that go to work every day, waiting on their check on Friday. So we basically have to meet people at the subway, at the grocery store, at church, at places that they frequent every day, and hands-on touch with them. Because I really feel like while the internet and while social media and everything has helped us to reach more people in different ways, that's not the only form of communication. We're not reaching everybody that way. We got to go touch the people. We have to.
Yeah, we're doing a whole another campaign where we're using a lot of radio. And someone said, why are you spending so much on radio and why are you spending so much on digital ads? And it's not just, and the truth is that we're not spending any money on satellite radio. And the reason is because I feel like if you can afford a satellite radio bill, you're not who we're trying to get. So, all of our ads are going to be up on terrestrial radio. So, I think that we just really have to start thinking of new ways to reach the people that we want to reach. We can't do, it might sound silly as people say, well, they've always been ads on the radio. Not really,
Not really. No.
The ads that go on the radio are usually run at 2-3 o'clock in the morning. So you have to make an investment to get the ad run in the middle of the day versus 2 o'clock in the morning when everybody's asleep.
And you're talking about new ways, but it's not really the new ways. It's kind of going back to the old ways. Add the old ways back,
right. And we were actually just, I think, been thinking about this too. It's like all of it, is it, I think at one point here, we had like over 200 barbershops that we were distributing condoms to.
Yep, exactly.
And now I don't think anybody does that anymore. And someone has said, well, you've got PrEP technology, so are condoms in as much fashion as they used to be? And I'm like, maybe for some populations, PrEP is a thing. But I think for other populations, the reality is pregnancy. It's pregnancy prevention, STD and STI prevention. That's what we're after. And so, and I think that, again, that's a bit of what COVID has taught us, is that we've got to remember the ways that we did reach people at a certain point.
And it's not just monolithical. It's not just one thing. It is a gamut, and it's very, very intertwined, and it's very complicated. It's not a simple black and white, go do this. And
this is called black and red, not black and white.
Black and red.
Okay, sorry. I just wanted to make sure we got it plugged it one more time again. So look, I have a bunch of questions here, and I was supposed to have asked all of them, but I've asked none of them. So now I'm going to try and squeeze in a couple of them.
Okay.
All right. So, how do you believe the COVID-19 pandemic has impacted Black people here in D.C.?
The COVID-19 pandemic has impacted Black people here in D.C. Several different ways, because Black people are several different people. So you have the Black people that are high earning people, and where they were at home and they had their, office, stay at home office, but then the kids were in virtual school. So they're depressed. They're going nuts. They don't even know how to even, I don't even think people even understand the stress of being at home worker, working from home, and virtually training your children at the same time. I don't think people we've even seen what the after effects of that is. It's just a stress of there's no boundary now between home and work.
Right.
So you have those people. Then you have the Black people that were the frontline workers, because mostly here in DC, those are frontline workers, your grocery stores, your nurses, And all of them that have gotten sick several times, that have had to get the vaccine because they were mandated and they felt like their rights were being taken away, but then you have some of them that feel empowered because they was like, I was a part of the solution. And so they felt good about it. And then of course you still have the people that's trying to still recover with, financially,
right.
Are they getting their job back or not getting their job back? Do they have to pivot their careers? Is there anything else still out there for them? So, it's just this whole thing that is several different types of people and Black people, so they probably feel the same way. Black people is affected just like how everybody else is affected.
Right. Okay, cool. So how do you think the COVID-19 pandemic impacted you?
The pandemic impacted me in a major way. I feel like before the pandemic, I really had kind of settled into I can't be all in the community doing all this work no more. It's too much. It's too taxing. I got to take care of my boys. And it reignited in me. If you're not doing it, then who gonna do it? You're actually responsible to do it. And you need to be getting other people to get with it and do it. Figure out your capacity and then do it that way. So that's what it personally did to me, because it highlighted the health disparities and unaddressed health disparities, and how the people that needed to be reached were not being reached because the tactics to try to reach them were not good, because the people that's trying to reach them don't know how to deal with that population. Right. It was annoying,
Right. Now, this isn't on my list of questions, but I'm going to ask because you brought something up to my attention. What happened to the Center for Minority Studies? Now, this is your nonprofit that you started with other pharmacists. Do I remember this right?
Yes.
That it was other pharmacists who started this group.
It was a pharmacist ran two, founded by 2 Howard pharmacists and 2 FAMU pharmacists. And the grind, I was so young and naive when we started Center for Minority Studies. We didn't understand the political part of the nonprofit world and government funding. And we also did not marry or understand that it's a small business. So when your check don't come, you still responsible for payroll, and you got to keep on applying for grants and keep on getting money. It was a hustle. So it transitioned from doing the same thing that happens to any small business owner, where you stop doing the work because you're now an administrator, and we didn't have the infrastructure in place. We didn't have the money in place to keep it going.
Right.
And I was burnt out. I was tired. I just wanted to be in a place where I just get a regular check every 2 weeks. Right. I had gotten to that point because it was so many times where I didn't get paid because I had to pay everybody else. I took out a home equity line of credit to pay my payroll. Right. I'm still paying on right now. Well, so it's that kind of hustle and grind, and I just couldn't do it anymore.
Well, I think people don't understand that, right? And I always say that. And I think that sometimes people start a nonprofit and they think that it's something else. And and whenever I kind of give a talk about nonprofit management, is that what I remind them of is that the only thing that's different here is your tax status.
Yes.
And what you're responsible to report to the Internal Revenue Service. But you're running a small business.
It's a grind.
And you need to treat it that way. And if you don't, your failure to treat it like that will kill the business.
Straight up.
Right. And but I think that's the other thing is, I think even now, I think many businesses, you talked about it earlier a bit, have had to redesign themselves, have had to pivot as a result of COVID. You say that you're teaching now, that you are a pharmacist now, and so I know you're a mom. I know that's your number one job. But so how has your career pivoted as a result of COVID, or did it? And I mean, I hear how it kind of personally you did things different, but
So for my career, again, it kind of had me refocus on what's really important to me. Because when I came into academia, again, it was like, I just want to be able to just get a check every 2 weeks and know that my check was going to be there. And, while I'm passionate about the students that I serve, I'm at a HBCU, I'm all about Black community, but it just really, COVID helped me to realize, one, you don't have to run the business in order to have the impact. And it made me realize my experience and what I have to offer, hence, why I continued on your board as the president, because I don't have to be the executive director to have an impact in the work that you're doing, but I can still help that way. And even just thinking about how do I reach the community? So I reach the community now. I don't go out to the community centers or the health centers anymore, but I started like a 15-minute live on like LinkedIn and Facebook because I just really had so many people asking me questions, and I was like, let me just get the information out there the best way that I know how now, so just thinking of ways to still do what's true to my passion, but it doesn't have to be so time consuming and so taxing.
Right. They say, I have a good friend who always says that, when we get more to conserve, we become more conservative. And I think becoming more conservative with our time is something that becomes very, very precious. I think you kind of hit the nail on the head for me in a lot of ways that, at a certain point in your career when you're no longer doing the work, right? I mean, for me, I'm not the greatest implementer, but I love to have the great people around me who can implement. And I have a great group of people around me now who are implementers. I can come up with an idea in 15 minutes, but then getting that idea implemented requires other people. And I think that we all can't hit a wall. The idea or the concept around black and red was a couple of things. One is just this belief that many people have that they're not black folks in red states or in southern states doing good and impactful work. And I just want to say that I don't think that that's true. And one of the things we wanted to do is figure out new ways and innovative ways that we could get vaccines to people, but also to get people to have a conversation about a vaccine and maybe give them an idea of if they couldn't talk to who was in their network now, think about some other people you might be able to go talk to about making your decision about a vaccine. Because, I just feel like everybody's got a different reason for saying yes, and everybody's got a different reason for saying no. I was high on the altruism scale. So that meant I went and ran out when they said there was a COVID trial, I ran. Give it to me, give it to me, give it to me. And then I think that there are other people that are friends of mine who are just like, my job said I got to do it, so they did it. And then I still have other friends who are like, I'm still not doing it. I don't care what you say. And so help me understand, if you were going to deliver a message, not to somebody in DC, but you're going to deliver two messages. One, what's your message to pharmacists who are maybe ambiguous about encouraging their customers to get the vaccine? And then tell me what you tell Jane or Joe or Hakeem in Alabama who has said, no, I don't need the vaccine. Give them two messages from me.
So for the pharmacists, I'm going to say thank you so much for your service. And I know you're burnt out and I know you're tired. And you don't have to ask every single person, but commit to asking one person a day if they got the vaccine. And even with that one person, if you can impact them, you've done your job for the day. To the people in Alabama, you dead set, you don't want to get the vaccine. I'm going to ask you why. Because I want to hear, why don't you want to do it? And I want to understand why you don't want to do it. And I want us to have a conversation. And so while you may not be able to ask me, you can ask your local pharmacist. You can even just ask somebody you trust, but at least engage in the conversation. And if you do want to ask me, you go to my YouTube page, Pharmacy for the People, and we can talk about it. But I believe in a conversation. At least be open for the conversation.
Okay. You just gave me something else. Now I was wrapping this up, but now you gave me Pharmacy for the People. What is Pharmacy for the People?
Pharmacy for the People is my passion project. It is the way that I am able to reach the community and give them the information that they need in regular layman's terms, the same way I used to do for CMS.
So Pharmacy for the People is at Pharmacy for the People.
So it's a YouTube page. So if you go Pharmacy for the People, the number 4, you're going to see all the recordings that I've done on either Facebook or LinkedIn. And then I upload those videos on YouTube for anybody to reach it.
So tell me some of the topics.
All I've been talking about is COVID.
Okay. All right.
And I'm so tired of talking about COVID,
Good.
but that's the questions that people ask.
Right.
You know, so I talked about like, you know, why you should get the vaccine or what to consider when you're thinking about getting a vaccine. I talked about like what it means when you actually have a positive test. What does that mean? Or don't just wait for the positive test, because people walking around here with walking pneumonia and sinusitis and all type of stuff, but just because they don't have COVID, they're still not treating themselves. Again, this whole health thing. And I just talked about boosting your immune system with foods, getting enough rest, staying stress-free as much as you can, you know.
Right.
But if you have a intact immune system, you can fight any bug out there, including COVID.
So, all right. So, what I mean, can people, like, what if people want to use these YouTubes? Can they put them on their page?
Yes, they can.
All right.
Yes, they can. The information is for everybody. I just want people to get the information and feel like they can see a face that they maybe can trust. And that's not a talking head on CNN or the news feed all day, a regular pharmacist that's been out here in the community just answering the questions that they have.
Wow. I mean, you know, and this is what we're trying to do with Black and Red, is that we're trying to have some real conversations with real people to, you know, I mean, I feel like if we can get one more person to get vaccinated than was yesterday, we've done part of our job. But, you know, there's COVID vaccination, there's influenza vaccination, you say there's shingle vaccination, there's
herpes.
The herpes, I said the herpes, didn't I? And so there's tetanus. And so but I can get all of these at the pharmacy.
You can get every single
Hey, wait a minute. Does my insurance cover all of these?
Your insurance covers everything. Because what you got to understand about your insurance don't want you in the hospital. They're covering everything preventive for you. So they want you to get your vaccine. You could just show up with your insurance card and get any vaccine, depending on the state that you are in, from the pharmacist. Your pharmacist, for some states, the only difference is whether or not your pharmacist is going to have to call your doctor. But for most states, you can just say, I want that vaccine, and it's going to be available to you.
What if I don't have insurance?
If you don't have insurance, you can definitely get the COVID vaccine. Now, if you go to a small independent pharmacy, they can connect you with someone that can get you insurance so that you can get the vaccine.
Okay. So I can still maybe get all of those. It just might be a step or two more, right?
Yeah.
Okay. And so in DC,
and also even for the flu, a lot of states, they have vaccination clinics, free flu clinics.
Right.
So, you know, you can call your local state health department to figure out where you can get the free flu shots from.
Okay. So the message here today is talk to your pharmacist, local or big box.
Yeah.
Because those are, I mean, there's probably some people who's like, I mean, actually you can get more one-on-one time with them sometimes than you can do with your private practice physician.
Yeah.
I mean, you know, I do. It's like my pharmacy. I live in West Virginia now, but I know I still sometimes have to pick up something at my old pharmacy here in DC. That guy still knows me. He still says by my first name, how you doing?
Mm-hmm.
So I think that there is something there. I think we saw it in West Virginia with COVID vaccination running through small retail pharmacies that are on Main Street. I think what you're talking to us about is ways to have conversation also with our pharmacist. I think we got that message. And most importantly, I guess I just want to tell you, thank you for doing this. Thank you. I mean, I know you're super busy, but I really do think that the pharmacists are critical in our fight, not just around COVID or influenza, but I think we see, you know, new PrEP technologies coming out. We see hepatitis. I think that they just play such a critical role in our healthcare in this country.
I am honored to have been able to participate in this project, Black and Red, with you, Toni, and just thank you for highlighting the pharmacist and the role of the pharmacist and reminding people how accessible we are and how much we can help people on the spot every single day. And it's not just about COVID and not just about the flu, but overall general health is the main point that I think that you highlighted for me today.
Perfect. Thank you very much. I look forward to it. And thank you all for joining us for another episode of Black and Red.